Ladies and gentlemen, welcome to MedSynapse. Today, we're delighted to welcome back Dr. Basema Jaber for our second podcast together. Dr. Basema is a highly accomplished consultant obstetrician and gynecologist at Emirates Specialty Hospital in Dubai. With more than 35 years of experience, she's a trusted authority in her field. Welcome, Dr. Basema.
Thank you for this chance.
Thank you so much for joining us today. And the topic for today's discussion is human papillomavirus, or HPV in short. First question. Dr. Basema, could you explain what human papillomavirus is and how it affects women's health?
Actually, HPV is a virus like other virus. Now we have more information about virus after corona problem. There is a lot of kind. It is DNA virus. We have more than 200 kind. Some kinds are benign, but some kind as dangerous. That means some kind of this virus cause benign lesion, and some kind of this virus cause cancer. Cancer in cervical, cancer in vaginal, anal, in vulva. And some kind of benign cause only something benign warts vulva. So other problem we fixed that there is a lot of problem to diagnose it, because when we infected in HPV there is no clear symptoms. Even it is too much, more than 660 million people get HPV. Of course, HPV is more common between males. 90% of affected is male and 85% is female. But sometimes HPV come and go without we know. Like spontaneously clear from our body. That's why we have to certain if we have any HPV, because we have to be close monitoring if we have any lesion to discover it early and to avoid serious problem.
Now, moving on to the HPV vaccination, how do you recommend it for your patients, and who should get vaccinated, and what are the recommended dosages?
Yes, for vaccine, of course, because HPV is a virus, so we can create a vaccine against. But problem is we have to take this vaccine early before we face this virus. We know that HPV virus is STD disease, bisexual. So we have to get this vaccine early. That means we can start from 9 years. Usually we get it between 11 to 13 years. And we must give him if male or females. We can give to both gentle. Other things, if we get vaccine before 15 years, we can get only 2 doses. 1 dose first, we called it 0 dose, and after 1 month, other dose. And usually we get it in upper arm, in the muscle in the upper arm. But if after 15 years, we have to get 3 doses. 0 after 1 month and after 6 months. Usually there is 3 kinds of cervical cancer vaccine. New one is from 9 virus, and it's not only protect from 9 virus, it's protect from more and more. But they try to discover more and more protected vaccine. And I think there is a lot of way to protect of ourselves from HPV. I think to take vaccination is a one good and safe way to protect ourselves from HPV infection.
That's an essential preventive measure for the young patients in gynecology. Now, let's discuss HPV testing and its role in screening for cervical cancer. How often should women undergo HPV testing, and at what age should they start?
We can discover lesion early. Pap smear done from 21 years. Every 3 years it is normal. Every 3 years to 65 years. But if we add to pap smear HPV typing, or we did only HPV typing, we can do this test screening, this important test, every 5 years. So what we face as our problem as doctor, a lot of insurance company not cover HPV typing because it consider it as a STD disease, so it is not covered by insurance. But I think it is deserved to do typing HPV every 5 years to check that we don't have any problem. This is a way, first way to screening about HPV, second way to taking vaccine, and third way, we have to take a healthy lifestyle. Because, on corona, we can understand some people get corona and cure without anybody know. Why? Because they have good immune system. So when we try to make our immune system strong, even we get infection, we can solve it. Even we don't know. Like, avoid smoking, avoid stress, doing sport, eating something good, avoiding alcohol. All these things which make our system good, healthy lifestyle will avoid us to taking not only HPV and cancer, and we have to take care of some deficiency on some vitamin, especially vitamin D and also vitamin A. So if we take care of these important points, we can avoid taking problem with HPV.
Now, let's explore the treatment options for women with high-risk HPV or abnormal cervical cells. How do you decide on the best treatment approach?
There is two kinds of HPV, benign and risk. And risk kind of HPV may cause pre-cancer lesion and cancer. And even this pre-cancer lesion, there is a different kind. What happened when HPV come to the cells? Like all virus couldn't increase the number of itself by itself. That's why she go to other cells and she use DNA for other cells. The DNA is all things in the cells is DNA. When destroyed DNA, this is a problem of risk HPV. And we have multiple cases of this lesion. We have a pre-cancer lesion, which we couldn't discover unless we do not only pap smear. Pap smear is a screening test. It is not diagnosis test. When we feel that pap smear is not normal, we see any lesion not normal, or sometimes, by the way, we saw pap smear is normal, but clinically we saw a lot of discharge, a change in the appearance of the cervical. It is important to do colposcopy. What is colposcopy? In colposcopy, we use microscope and we deal with the cervix with putting some solution, which makes this infected area more clear. So we take bench biopsy from this area. And according to histopathology, they give us report. According to this report, we plan our treatment. What happened in the infected cells? There is increase in the nuclear of the cells. Yani, we know that cells is like ball and nuclear is smaller. And cytoplasma is more and nuclear is smaller in healthy cells. But what happened in HPV infected, we have is bigger nuclear because damage for DNA. And we have smaller cytoplasma, and we have also a gap in the these infected cells. Of course, these cells is destroyed, and we have to finish from it. But we have 2 or 3 lesions pre-cancer. We have mild lesion, which we said cervical intraepithelial lesion, which low. يعني it is not يعني these infected cells is not in all thickness of tissue of cervical, only third thickness of cervical. So we said this is CIN1, and for CIN1 we don't do anything, only we close monitoring. Transfer to cancer need 15 to 20 years. But if we have problem in our immunity system, sometimes in 5 years it is go to cancer. So for CIN1, we don't do anything. Only we educate the patient how to increase their immunity. We ask her, you eat too much sugar, you are smoking, you don't sleep good, you don't do any sport. We have to involve in her lifestyle. We have to guide her to do interrupted fasting, to allow carbohydrate, to do fasting, to do sport, some kind of sport, weighting exercise, walking, to avoid alcohol, to avoid chips. You know, a lot of new food is very bad. It is not healthy for our body. So we guide her, and for me, my journey, a lot of patients, survival from CIN1. But when we go to CIN2 or CIN3, that means all thickness, all 20-third of thickness of cervical with these infected cells, these destroyed cells. What we have to do, we have to remove these destroyed cells to avoid making it go to cancer. Even cancer, we have cervical cancer, which is only some cells can aggressive to basement cells and go down. So it is very difficult even by histopathology to differentiate it between CIN3 and between cervical cancer, which is in situ. It's still not separate, but we can deal in different way. This is according to for example, what the age of the woman. If she is in her reproductive life, she don't want to get pregnant, we can do total hysterectomy. If she is still young, we can destroy this lesion in several ways. Sometimes we use cryotherapy. The cryotherapy is used liquid machine. It is cold and destroyed cells by this cold, increased cold. It's caused some burning sensation. But this is, I don't prefer it. You know why? Because I prefer to take biopsy, not only destroy. To take biopsy to check that this biopsy is healthy margin. There is no affected cells in the margin. Of course, I said about CIN2, CIN3, or cancer in situ, which it's not appear. There is no even symptoms, even sign, nothing. You don't see anything. Also, we can use acetic thiochloric acid. by acid we can burn it. Also we can burn it by electrocautery. By laser, laser cause heat. By heat we destroyed red blood cells, destroyed vessel which is nutrition to these cells. A lot of things we can destroy these cells, and we can doctor clinically choose any way for which is suitable for his patient. But for benign warts, also we can usually use cryotherapy, which is also cause some burning sensation, but it's good. In 14 days we finish from warts. We can use it also by electro. We can use a lot of things. Surgical sometimes if it is big warts. A lot of things we can use. Udophilia, which destroyed also cells. We couldn't use one way to all patients. Every patient we can choose good method. Sometimes by medication there is Aldera which increase immunity and could finish from warts if it is only small and not too much. So according the site, according immunity, according to the case of your patient, age, reproductive case, you can choose a lot. There is multiple choice, and all of these can destroy these cells, because these cells we need to destroy it to give our body to build some fresh healthy cells.
Now let's talk about HPV infection and its impact on fertility and pregnancy outcomes.
Usually male is more infected, and it is more difficult to discover infected in male. And usually male don't want to do any tests. Usually, I don't know, maybe in other country not like our people, but usually male refuse even to do semen analysis. They discover that there is increase in infertility between male who have infected. Why? Because HPV virus go to the head of sperm. We know that DNA of sperm is in the head, so it goes to the head of sperm and goes destroyed. This is cause less motility of sperm. We know that sperm motility is important too much because egg is in the tubal of fallopian. It is far away. So to move from sperm to get fertility, to go to the egg, it will be difficult if there is problem in motility. Also, there is other problem in quality. There is other problem in number of sperm. Actually, as HPV was destroyed to DNA, it was what we said fragmentation in sperm. And if sperm is infected, when fertile egg, it will be infected egg. And that is why we face more miscarriage between couple who's infected in HPV. More miscarriage, more difficulty to get pregnant. Because there is a difficulty in implementation. Usually uterus refuse any unhealthy egg. Usually uterus not allow to unhealthy egg to implementation. That's why, of course, it causes problem to infertility. Not only because that, even during pregnancy, sometimes it is infected by placenta and by water around baby. But even they said it is rare to go to baby. Even go to baby, he can solve his cells. His immunity could. But some rare cases, if there is a lot of warts, cause warts in throat and this is maybe blocking path of breathing. So it is, we have to take care of this issue. As I told you, love transmit to the baby, but in rare cases it happens, and if it happens, it is really serious. So a lot of doctors, when there is wards, prefer to do cesarean, not doing any normal delivery, and if there is wards, they can treatment it by laser. So other things, my dear, we can treatment lesion by colonization. Yani we get a part of cervical for pre-cancer lesion. So this will make the cervix more weak. So we have premature delivery. We have rupture of membrane early. And in my mind, this is not good for outcome of pregnancy. So I think yes. And the new research is focused. Other things, to discover pigmentation in DNR, and a lot of infertile, well, we don't know why. She said everything is good, even semen analysis is good, but there is problem in fragmentation. There is problem in quality. That's why it's not successful, not in normal pregnancy and not even in IVF. This is what we need to focus, to do PCR by semen analysis. We have to clear this issue. Because we know, we study that 10% of infertile is, we don't know, it's essential. We don't know. Maybe because of this, we don't know because we don't search about it. And this problem is, it is common virus, it is skin to skin, even by use condom, we couldn't prevent. Why? Because some skin without condom can transmit. So, we have to focus on screening, vaccine, and increase immunity, taking enough quantity of vitamin D by the sun. Our old generation said, if there is sun, there is no doctors. Yes, because sun means vitamin D. Prevent us from a lot of disease. By the way, even deficiency of vitamin D cause even anti-malarial hormone will go down because no enough reserves of eggs. We even follicle in the ovary will go by deficiency of vitamin D. You know what happened? What happened is apoptosis for cells. This cells is not ready. We know some cells apoptosis, some cells new fresh. There is no enough new cells if our lifestyle is not good. More apoptosis. This is what happened to semen. This is what happened to eggs also. So we have to focus on our children, on ourselves, to healthy life. No obese, no deficiency of vitamin D, sport, no smoking, no alcohol, no sitting too time.
Now, what are the current recommendations for managing abnormal results related to HPV infection? Like, how do we manage it?
If pap smear is abnormal, we have to go to typing HPV. Mm-hmm. And if typing HPV is positive, especially risky, we have to go to next step, which is colposcopy. We see cervical by light, by microscope, by adding substance which make infected area is clear, and we get branch biopsy, and according to histopathology, we can determine how we can get good treatment for our patients.
Now, from your experience, what do you consider the most important things for obstetricians and gynecologists to know about managing and preventing HPV-related conditions?
We have to educate our patient about screening. And also, we have to get vaccine in good years, as I told you, from 11 to 12 to 13. And even we can get it to age of 45, from 27 to 45. And we have to avoid smoking, avoid alcohol, try to deal with stress by breathing exercise, we have to discover what is toxic in our life.
Now, lastly, our final question. Let's address the risk of transmitting HPV from mother to her baby during childbirth. What measures can be taken to reduce this risk?
It is not big risk. Even they said maybe it's transmitted through placenta, through water, but I think it is rare. But if we have warts, really, it is better to avoid any warts in the throat. As I told you, they discovered that baby can survive from HPV. By the way, through what I studied before, we discovered even young people getting more infected by HPV. But this infected come easy and go easy. You understand me? That's why we don't advise anybody to do screening for HPV before 21, because maybe he get and solve in 2 years spontaneously without we get any medicine. And even we have HPV without lesion, we don't taking anything, only improve our immune system. They discovered before, they doing pap smear even from start their sexual activity. That's why they do a lot of aggressive treatment, like colonization. That means they remove cervical, which is very aggressive. Its influence on her reproductive life. She couldn't maybe deliver baby. She will deliver premature. You understand? Why I will do treatment or something, we can heal it spontaneously. As I told you, 90% of this lesion of HPV infected will resolve spontaneously in 2 years. So in young people, they will get more because in this age there is multiple sexual relationship, but they can cure also more. Infected in more adult is more problem, more cause to lesion. You understand me? That's why we start from 21, not before. Because for younger, maybe get and clean, color. But we have to educate them for how, why dangerous multiple relationship, what about partner, whose partner, what behavior. Multiple partner is a very big risk factor to get problem. Not only, if you have HPV, that means maybe you have HIV, maybe you have hepatitis B, chlamydia, mycoplasma, uroplasma, all these things, gonorrhea, STD disease, not one come. When come one, we have to search about everything, because this disease cause problem to the fertility in female. And sometimes it causes PID, pelvic infection disease, which is sometimes the fatal disease. Cause abscess even arrive to labor. I think it is important even before marriage to do PV tests for both of them.
Definitely.
I think يعني now I said to myself, why they don't do that? Why they don't do that? We have to do something. يعني for male we can do it in semen analysis. Why when male married they don't do semen analysis? Maybe he is with infertility. Before marriage he can say yes or no. Why female? You don't know how much female get problem when she is not get pregnant, and you don't know how many years you need to make any man to do semen analysis. This is simple test and give us good idea, not full idea, but good idea. And sometimes they make his wife getting a lot of induced ovulation, go to do HPV radiation, taking a lot of problem. And he said to her, no, I am good, I am man. Well, maybe he has other problem. We don't know. That's why we need to think in other way. By the way, we can discover HPV from anal or homosexual, as they are increased in this day. And we couldn't speak about them. But there is a way to discover if they have any HPV virus by anal pap smear.
I believe that raising awareness and educating our society can help prevent HPV in a maximum way.
Inshallah. I hope that.
We are grateful for your willingness to share your knowledge on this important topic. Thank you so much.
Thank you, Habibti. Thank you very much.
Thank you. And before we conclude, we would like to take a moment to acknowledge MedSynapse. MedSynapse is a leading platform that brings together healthcare professionals, fostering collaboration and knowledge sharing. We encourage you to subscribe to MedSynapse to stay updated with their engaging discussions and gain access to a wealth of knowledge from experts in our medical community. That's it for today's podcast. Thank you for joining us. Stay tuned for our next episode. Take care. Goodbye.